We're going to talk now about herpes simplex virus, type 1 and type 2. The human herpes simplex virus is responsible for many diseases. Could be just a disease in the skin, could be a genital lesion, could be encephalitis, meningitis, keratitis or keratoconjunctivitis, and gingivostomatitis. Usually these two are seen more commonly in children. Could be after infection passing through the birth canal. This would present around 2 weeks after birth. The lesion in gingivostomatitis, this would present with ulcers, vesicles in the palate that are very painful, and so the children refuse to eat, and so these children are going to be dehydrated, and because they are not taking even water, and so they need to be admitted to the hospital. The skin lesion is just, for example, in the finger or in the hand, there is just the herpetic lesion, also called finger willow. In the genital, there is genital herpes that could present with burning. Clinical symptoms would be burning. It could disappear and recur as every infection of herpes. This genital herpes is important because if the mother has genital herpes, active genital herpes, or the vesicles are ruptured, or if the patient is in the prodrome, that is just flu-like symptoms or something like that line, and then the delivery must be with cesarean. It is a C-section. It could not be vaginal delivery because the baby has a risk of getting infected. And next, the treatment for all of this is acyclovir. Acyclovir do not end the infection, just decreases the symptoms, the rate at remission or relapsing, but no ending of the symptoms. The patient could start with acyclovir. If there is some alteration, let's say, of the kidney, we just reduce the doses. This specifically, for example, in encephalitis, because of HSV, we could not take the patient without giving the acyclovir. So we do acyclovir, and if the creatinine is raising, we just decrease the dose, but we cannot end the treatment. We have also this sore lip, or that sun sore, that is like the herpetic lesion commonly seen in the lip. The acyclovir is the preferable treatment. It could be IV or oral. IV, for example, for encephalitis, oral for whatever. If there is resistance to acyclovir, we could give valacyclovir or famciclovir or penciclovir. The problem with valacyclovir or famciclovir is that these are oral medications. So in encephalitis, if there is a resistance to acyclovir, we could not give these two, and we should give foscarnet. Next, all these are caused by herpes simplex type 1 and type 2. Type 1 usually arises from the waist up. So, for example, encephalitis and all those things, the herpetic sore, and that would be primarily H1. And the genital herpes, that is below the waist, is usually herpes simplex type 2. But there are exceptions. For example, the encephalitis in adults is usually because type 1, but in children that they got infected when they passed through the birth canal, so would be HSV2. The clinical symptoms of encephalitis is mostly confusion and altered mental status. So here the best next step would be take a CT scan. Next, the The herpes virus is a virus that the person is going to stay with the virus all their life. This is because there is latent infection, that is, the virus is in the cell but is not replicating. There is no active lesion. This is a episome. A episome is when the DNA of the virus is inside the cell but is not yet inserted in the cell. So there is no replication of the virus, but the virus is still there. And this DNA that is not inserted, this episome, can be detected. We can detect it with studies. Next, the diagnostic test could be someone's, could be just clinical, but for any confirmation that we need, could be PCR, and could be the Crowley inclusion. We will see inclusions, specifically intranuclear inclusion, because the herpes virus is the only one that the assemble of the virus is inside the nucleus. So the membrane came from the nucleus and not from the cellular membrane. It's from the nuclear membrane of the cell. So we will see intranuclear inclusions. And we could also see innate stank smear. We will see multinucleated giant cells because of fusion of these cells.